today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, the Honourable Dorothy Shepherd, Minister of Health, and batting cleanup is the Honourable Blaine Higgs, Premier of New Brunswick. Bonjour tout le monde et bienvenue.
Hello and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honourable Dorothy Shepherd, Minister of Health, and Premier Blaine Higgs.
Thank you, Bruce. Merci, Bruce. Bonjour à toutes et à tous.
Good afternoon, everyone.
Today, I will be reporting on the Parkland St. John outbreak, an update on our COVID-19 vaccination program, the outbreak in Zone 4, which is the Edmundston-Grand Falls region, the sporting tournaments, and the importance of everyone keeping their steady 20 personal contacts. Aujourd'hui, je discuterai des points suivants. L'éclosion.
Today, I will be reporting on the Parkland St. John outbreak, an update on our COVID-19 vaccination program, the outbreak in Zone 4, which is the Edmundston-Grand Falls region, sporting tournaments, and the importance of everyone keeping to their steady 20 personal contacts.
That another round of testing is occurring for employees and residents of Sims Court today. And to date, the case count remains at 20 confirmed cases at Parkland St. John, 8 employees, 1 non-Shanix employee, and 11 residents. A total of 1,871 individuals received their first dose of Pfizer-BioNTech vaccine at New Brunswick's first COVID-19 vaccination clinic, which was held in the Miramichi Hospital over the weekend. This was obviously a very historic event, and I was very pleased to be able to do a site visit that morning and say hello to all the staff, the people directing traffic, the people who were immunizing, doing the screening. It was amazing. So a 2-day clinic. They were following the individuals from priority groups received the vaccination. So 9 First Nations health centers, 365 adult resident facility and long-term care facility staff, 352 local Shanix residents and staff, 237 Vitalité staff, 512 Horizon staff, and 396 prompt extramural, Ambulance New Brunswick, and social development staff. And the remaining vaccines will be administered to frontline healthcare workers and workers in long-term care facilities in Miramichi. And public health staff will be contacting employees through the Horizon Health Network and also through the facilities in the area. Again, quite a momentous occasion, and obviously a drop in the bucket in terms of how many more people need to be immunized, and hopefully we'll be able to say that we've gotten where we need to be by September in 2021. But we do have a long way to go, and but it is very heartening and inspiring to be where we are right now. I do want to highlight the fact that we saw healthcare professionals from Horizon Health Network, Vitalité Health Network, the Extramural Program, Ambulance New Brunswick, Public Health New Brunswick come together as one team, working together side by side, and I just want to thank everyone for a job well done. And obviously, New Brunswick as a province has been doing amazing work as a team. So I'm very, very proud of everything that people have been doing to get us to where we are right now. Je tiens à souligner que les professionnels.
I want to highlight the fact that we saw healthcare professionals from Horizon Health Network, Vitalité Health Network, Extramural Program, Ambulance New Brunswick, Public Health New Brunswick come together as one team, working together side by side. Thank you for a job well done. And also for the work of all New Brunswickers.
Experience will be applied in a few days in the Moncton area as we prepare for immunization clinic in Zone 1 and all future clinics. And again, it really was a well laid out, well run operation this past weekend. And again, I can't say enough to thank the staff, all the partnerships and the work that went into that. Hier, le personnel de première ligne.
A call was issued yesterday inviting frontline staff members and physicians who have direct contact with patients in the following settings: emergency departments, intensive care units, COVID-19 units, COVID-19 testing centers, and the laboratory, and all the staff who will vaccinate in the vaccination clinics from December 23rd to 27th against COVID-19.
Nouveaux cas dans la zone 4, de l'importance de la santé.
Taking into consideration the slow growth of new cases in the Zone 4, the importance of the holiday period to many, lack of new infections of healthcare workers, and balancing the social determinants of health, Public Health recommended to Cabinet to move Zone 4 to the yellow level of recovery effective as of midnight tonight. I want to commend the staff at the Edmundston Regional Hospital and Vitalite Health Network for their efforts to treat COVID-19 patients and control the outbreak. It is very difficult to, when you are stressed out while there is an outbreak, to take care of people who need care. So I congratulate all the people who were involved in treating the outbreak at the hospital in Zone 4.
New cases in Zone 4. Considering the mental health and well-being of New Brunswickers at this time of year, the lack of new infections of healthcare workers, and balancing the social determinants of health, Public Health is recommending to Cabinet to move Zone 4 to the yellow level of recovery effective as of midnight tonight. And so that decision was made earlier today. I can advise you that testing of staff and members of certain units in the hospital continue regularly. And I also want to thank everyone in Zone 4 for taking the rules seriously and doing your part to move your zone out of the orange level just in time for the holidays. But the caveat is that obviously we are expecting new cases possibly in that zone because there are still some people self-isolating, and we are aware of that. So we are cautiously optimistic that we can get through the holidays without seeing a spike in cases, but that will depend on everyone's cooperation and everyone following the public health directions. There are 2 new confirmed cases of COVID-19 in New Brunswick today. The 2 cases are in Zone 1 in the Moncton region, and they are as follows. 1 individual, age 20 to 29, and this is a contact of a previously confirmed case of COVID-19. And 1 individual, age 60 to 69, and this is a travel-related case, and both of the individuals are self-isolating. We are seeing an increasing number of travel-related cases. Obviously, during the holiday season, people are traveling more, but it is a very dangerous time to be traveling with the case numbers going up all around the country, all around the globe, and also in the U.S. There are currently 46 active cases of COVID-19 in the province, with 2 individuals hospitalized, including 1 who is now in intensive care. And I do ask that you keep these people and their families in your thoughts and prayers at this time. Aujourd'hui, j'annonce qu'il y a 2 nouveaux cas confirmés.
Today, there are 2 new confirmed cases of COVID-19 in New Brunswick. The 2 cases are in Zone 1, the Moncton region. 1 individual, 20 to 29. This case is a contact of a previous confirmed case of COVID-19. 1 individual, 60 to 69, and this case is travel-related. And all of these cases are self-isolating. There are currently 46 active cases of COVID-19 in the province, with 2 individuals hospitalized, including 1 who is now in intensive care, and I would like you to keep these people in your thoughts. Due to the risks associated with large numbers of individuals gathering at sporting tournaments and the typical social gatherings that follow these types of events, Public Health is advising that sporting tournaments will not be permitted until at least mid-January. Regular play, such as a one-on-one hockey game, is allowed, but no tournaments, bonspiels, or major events can take place at this time. The risk is just too high. Once again, there are people all around the country in other provinces who are trying to manage really, really severe issues with COVID-19 right now. So we apologize for the inconvenience to individuals who may be organizing such events, but we need to keep everyone safe in New Brunswick.
With large numbers of individuals gathering at sporting tournaments and the typical social gatherings that follow these types of events, Public Health is advising that sporting tournaments will not be permitted until at least mid-January. Regular play such as one-on-one hockey games are allowed, but no tournaments, bonspiels, or major events can take place at this time. The risk is just too high, and we see the number of cases across our country and the places that are being overwhelmed right now. We really can't take any chances, and we do apologize for the inconvenience to individuals who may be organizing such an event, but we really need to keep all New Brunswickers safe. It remains very important to keep your number of close contacts low. I cannot emphasize this enough, especially during the holiday period. I can tell you that myself and all the other medical officers of health in the province are very concerned. We don't want to see a spike in cases in early January as a result of gatherings that are happening now. So please keep your number of close contacts consistent and very, very low. Il demeure très important de limiter ces contacts étroits, surtout.
It remains very important to keep your number of close contacts low, especially during the holiday period.
Up to a maximum of 20, but make sure that's the same consistent people that you were interacting with while not wearing a mask. Limiting your contacts will reduce the spread of infection so that we can avoid a surge of new cases in January. We still have a long way to go. En limitant nos contacts, il sera possible.
Limiting your contacts will reduce the spread of infections so that we can avoid a surge of new cases in January. We still have a long way to go, and I know that we are very concerned, myself and all the other chief medical officers of health of other provinces, that there will be outbreaks in January and a spike in cases. The only way we can reduce risks is to make sure that we do not have many close contacts. So it is really up to you to try to look after each other.
Can't be together, you can reach out. Please be kind and check in virtually over the phone with your neighbors, friends, family members who may be alone and self-isolating. And again, my wish for all New Brunswickers is that we have a safe and joyful holiday season, and going into the new year, having a safe January moving forward as we wait to get everybody immunized. Je souhaite que tous les citoyens du Nouveau-Brunswick.
I want all New Brunswickers to have a safe and joyful holiday season. Thank you very much.
Good afternoon, bonjour. Today, I'm pleased to accept Public Health's recommendation to move Zone 4, the Edmundston region, to the yellow level of recovery, effective as of midnight tonight. I want to thank everyone in this region for taking the rules seriously and doing your part to move your zone out of the orange level just in time for Christmas. Over the weekend, we began administering the Pfizer BioNTech vaccine in Miramichi. 1,871 New Brunswickers were vaccinated during the two-day clinic, and the remaining doses will be given to frontline healthcare workers and long-term care workers this week. An additional 3,900 doses arrived in the province this morning. Half will be used as the second dose for the first group who received the vaccine, and an additional 975 people will be vaccinated at clinics taking place in Moncton between December 23rd and 27th. We also anticipate that once it is approved by Health Canada, the Moderna vaccine will soon be available in New Brunswick. While vaccine shipments will continue to trickle in during January and February, we expect things to pick up soon in 2021. In the coming weeks, as we ramp up our vaccinations, information will be placed on our online dashboard to keep New Brunswickers informed about how many people have been vaccinated. I know some healthcare workers have expressed concerns about being able to get time off so they can travel to receive the vaccine. I want to assure you that as we receive shipments from different companies, such as Moderna, we will have more flexibility regarding storage. This will allow us to administer the vaccine in communities across New Brunswick. Please do not worry if you are not able to travel to receive the vaccine right now. Everyone must continue to be patient. This is going to be a slow process due to the limited number of vaccine doses we will be receiving initially. We will continue to work through our priority groups, and we will bring the vaccine to your region as quickly as possible. For now, New Brunswickers who fall into the priority categories are being contacted directly by public health. But all New Brunswickers will have the opportunity to be immunized once the vaccine supply is available in large enough quantities. This will take time, and we will need to continue to follow public health measures to prevent the spread of COVID-19. We will need to continue to wear our masks, wash our hands, practice social distancing, and self-isolate if required. I'm thrilled that our entire province is in the yellow level just in time for the holidays, which means we can celebrate with our loved ones in small gatherings. But if we want to stay at yellow, we need to keep our number of contacts low this holiday season. By sticking with our steady 20, we can help keep the virus contained, and this will help make contact tracing easier in the event of an outbreak. We are so lucky in New Brunswick to be able to have these small holiday gatherings. In so many other parts of Canada and around the world, getting together is just not an option this year. Many people have been forced to cancel plans and must avoid contact with anyone outside their immediate household. While we still have restrictions in place and rules that we must follow here in New Brunswick, we have a lot to be grateful for. Zone 4 has shown once again that our province is able to bounce back quickly from COVID-19 outbreaks. We have demonstrated our ability to move out of orange many times since we first came out of the red level in the spring. Of course, we all want to avoid moving to a more restrictive level if we can. I am confident that if we continue to follow the guidelines of public health and the rules in the mandatory order, we can keep New Brunswick yellow. 2020 has been a year unlike any other. It has not been easy, but New Brunswickers have stepped up. We have demonstrated our resiliency, our hardworking nature, and our kindness more than ever this year. We have come this far through the pandemic by working together. Let's continue to do our part and take care of each other this holiday season. Let's work to keep our province yellow as we enter 2021. And I want to echo Dr. Russell's words in saying, let's have a safe, happy, healthy Christmas season. I want to wish all New Brunswickers a Merry Christmas and a very Happy New Year. Thank you. Merci.
Bonjour, good afternoon. Right now, we are in a critical period. Nous sommes à la croisée de chemin. We have done so well for so long, and following the success of our first vaccine clinic in Miramichi this weekend, we can indeed see the light at the end of the tunnel. Now more than ever, however, I'm calling on New Brunswickers to take our situation very seriously.
Today more than ever, I ask New Brunswickers to take this situation seriously.
Here, we all have to make sacrifices to keep New Brunswick yellow and protect ourselves and our loved ones. We have seen how quickly COVID-19 cases can surge and get out of hand when people do not take the proper precautions. Right now, in the UK, a new strain of virus has been identified, and we have seen it spreading quickly in that country. We've seen a lockdown of the air travel to Canada for the last several days, and we're not sure how much longer that'll be necessary. Closer to home, we can see many examples of outbreaks that have gotten out of control in provinces like Quebec, in Ontario, and in Alberta. In Quebec right now, there are currently more than 18,000 active cases. And my commendation goes to the continued great work of our border officers controlling the movement back and forth between our provinces so that we know that people are coming here and following the rules when they arrive, if it's indeed necessary for them to come. What we see happening in Ontario right now, the province will be going back into a full lockdown right after Christmas. I have a daughter that lives in Ontario, and this year, my daughter and her husband and the 3 grandchildren will certainly not be coming for Christmas dinner. They won't be sitting across the table from us. We will be Zooming, however, and staying connected. Cases are continuing to rise in many other jurisdictions, both here in Canada and around the world. So we are indeed a little island unto ourselves, and we are certainly proud of the island that we've become. But we must continue to do our part. We cannot be complacent over this holiday Christmas period. We must enjoy the season, but we must find new ways to do that. We must make sure that everything we do is in consideration of what impact can my actions have on someone else. What impact can my actions have on someone who I love, someone who I always protected all my life, but I got a little complacent at this time of the year. We cannot allow that to happen. We need to keep contacts low during the Christmas period. We need to continue to follow the advice of public health. And above all, we need to remain vigilant. Now, I know that many people think, well, the vaccines have started. Let's put that in perspective. In New Brunswick alone, we will need for 2 doses for every citizen, 1.5 million vaccines. To date, we have 6,000. And we don't have a timeline of when the others will be delivering. We're hopeful, we're optimistic, and yes, we're so close. But close is not the answer. When we reach the finish line and we've reached the level of vaccinations necessary, that's when it's time to celebrate. But for now, we must continue the good work that we've had to date. We must continue to follow the rules. Mais pour l'instant, continuez votre.
So keep up the good work for now.
And this is a season when we all are thankful for so many things. We're thankful for family, and we're thankful for friends. And we're thankful for time to reflect on just how important family and friends are to each of us. This year, we need to be especially thankful that we're living in New Brunswick. And we need to be especially thankful that we've been working with such tremendous people who have gone above and beyond in every corner of this province to make us unique, to make us special, to make us successful. I am convinced if we get through the next few weeks, and we will know obviously the outcome of the next few weeks by the mid-January, if this virus is controlled through this time period, and we stay focused on the task at hand, we will be able to roll out the vaccines, the vaccinations faster than anyone else. We will have a province that will get back to green quicker than anyone else. And green is when the rules comes on. That green is when we get to a point that we no longer have an emergency order. And that is obviously what we're trying to achieve. So I'll be thankful for the time I'll spend with my family members that are here. I'll be thankful for the ability to talk to my other daughters across the country. As I said, one in Ontario, one in Saskatchewan, and their families. I'll be thankful for my mother and her 100th birthday, but we'll be thankful in small numbers. So I'm just asking each New Brunswicker, think about what you're thankful for, and think about what it would be like if we lost control in these next few weeks, and what January might look like if we did so. Think about what it'll look like if we can turn our province fully vaccinated back to normal faster than any other province in the country. Think about the trends we've had so far. Think about the role you've played in that. And let's together continue the winning formula, looking after each other and making sure that New Brunswick leads the way in health and safety of our citizens. Thank you very much. Merci et joyeux Noël et bonne année.
Merry Christmas, Happy New Year.
Merci beaucoup, Monsieur le Premier ministre, Ministre Shepherd et Dr. Russell. Thank you, Shepherd and Dr. Russell. Nous allons maintenant procéder aux questions des
We will now move on to the media's question. You can always ask the question in the language of your choice. Every member of the media will have one question and one follow-up. Please mute your microphones.
media. Each reporter will have one question and a follow-up today. You have the right to pose your question in the language of your choice, and please ensure your microphones are placed on mute. Silas Brown, Global TV.
Thanks, Bruce. This is for whoever wants to take a stab at answering it. I'm curious under what criteria the Moncton Zone 1 was chosen for the next vaccine clinic.
Thank you for the question. Really, it was, Horizon took the first load of vaccines, and so now we are operationalizing it under Vitalité. They are also the availability of the freezer. So there is a freezer at the Georges L. Dumont Hospital, and so that also played a role in this. When we get into other vaccines that are not going to need the temperatures that the Pfizer one does, we'll have a lot more flexibility about where it's going. So we wanted to operationalize this in both networks and ensure that it's going to be a flawless administration. I can't say enough about how well it went in Miramichi, and so that's really the reasoning behind that.
Mr. Brown, follow-up?
Yes, Minister, you mentioned that healthcare workers around the province shouldn't be stressing about getting time off in order to get to these vaccine clinics. So I'm curious if this Moncton vaccine clinic, is that going to be a similar mix to the Miramichi one, where we're going to see some healthcare workers traveling in and then other people from the community, or is this going to be a change in tact where it's going to be, for the most part, healthcare workers and other people in vulnerable populations from the Moncton area?
So for the 975 doses that are going to be applied, it's going to be all healthcare workers. Again, it's going to be from the priority groups that we have, and public health will be reaching out to those groups for accepting appointments. And again, we're going to roll it out as responsibly as we can, ensuring that proper shifts are covered, and that kind of those kind of considerations have to be taken. But this one will be all healthcare workers.
Thank you, Ministers. Thank you, Mr. Brown.
Sorry, just a quick clarification. Is that healthcare workers just from the Moncton area, or are we going to see people traveling from around the province? Just want to make sure that's clear.
So we will be leaving it up to public health to make those appointments. I would assume that because of the location, we will be dispersing this throughout healthcare workers in the Moncton area. But again, in being responsible with covering shifts, ensuring that we have the workforce that we need and utilizing the resources we have, we need to vaccinate everyone. So if we don't have the numbers to fulfill that 975, we'll certainly be looking at taking as many appointments, as many people as we can from wherever they can come from.
Thank you.
Thank you. Vicky Hogarth, CHCO.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, for the New Brunswickers who tested positive for COVID-19, particularly at the beginning of the pandemic, are you still monitoring those individuals for long-term health issues from COVID-19? And if so, what have you discovered?
There has been talk at the national level to try to capture that information across the country, but my understanding is there's no real formalized way that that's happening at this point, but it's certainly on the table that we've been discussing at the federal level.
Thank you, Doctor. Thank you, Ms. Hogarth. Do you have
I too is for either Dr. Russell or Minister Shepherd. When there are more vaccines available in New Brunswick, will New Brunswickers be able to choose which vaccine they receive if they have a preference for a specific manufacturer?
Just going back to your other question about capturing the data on long-term sequelae, Minister Shepherd mentioned that there actually is a project in St. John to look into that kind of information. And coming back to the choice, the prioritized groups, as the rollout happens with the different vaccines, they probably, I mean, if a person wants to wait for the next vaccine that's available, they are welcome to, but certainly it will be offered in order of the priority groups. So obviously, if you're not in a priority group, you're not going to get offered the earlier vaccines, but certainly by the end of the 7 that we are expecting to be rolled out and the ones that are further down the list in terms of the timelines of when those will be rolled out, they will be in much larger quantities. But again, I can't speak to the idea, to the effect of whether or not people will be able to choose which one other than, you know, when you're invited to come, if you want to wait for the next round, then you're welcome to do that.
Thank you, Ms. Hogarth. Thank you, Dr. Alexandre Boudreau, l'Acadie Nouvelle.
Oui, bonjour. Ma question est pour la Dr. Russell.
My question is to Dr. Russell. Like the Premier mentioned it earlier, in the UK there is a more contagious strain of COVID-19. Do you have the capacity to test for this strain of COVID-19 in New Brunswick? We learned that there is a new strain in Canada. All the research that has been done to see whether there were cases here linked to the same strain, we haven't seen it yet. The calls I've had with my colleagues, the other chief medical officers of health of Canada, and with people who do the research at the National Lab in Winnipeg, and I believe that there's also another lab in BC who is conducting research on that. We know that we should keep the results coming from other countries. So the only thing we can say right now is that there is another type and that the government of Canada will monitor closely this new variant that was detected in the UK. And we will collaborate with the World Health Organization to better understand the variants and the impacts. So we should expect to see genetic variants of the virus, and we will use the preliminary data and monitor this with the Canadian Public Health Agency. Do you have a follow-up question? Yes, my question is to Dr. Russell again. We talked about this a couple of weeks ago. Are you thinking about giving an ID to people with a vaccine so that, because maybe this could be a mandatory to come into public places or to travel? At Public Health, the protocol is that people will get a paper. What they will be able to do with this paper, I don't know. Our responsibility is to give the information on the vaccine that they have received, and we will have this information in our system online so as to have all the documents of all the people who got the vaccine in electronic record. Laura Lyle.
Hi, thanks, Bruce. This question would be probably best for Minister Shepherd. Minister Shepherd, what is going to be happening with testing over the holidays? Will there be any changes to testing capacity or processing or the availability of appointments?
So my understanding that with the exception of, I think, Christmas Day and perhaps another day, there's going to be a change in the hours, I understand, but there will still be availability. So Vitalite and Horizon will still be offering testing at all of their sites, but I think during Christmas Day, they're just going to have shorter hours. So the testing is absolutely still taking place and still available. Again, just shorter hours on Christmas Day.
Lyle, do you have a follow-up?
I do. I'm wondering if you can tell me how many healthcare workers are currently self-isolating in the Edmonton region.
I can tell you how many are coming out of self-isolation in the next day or so. I think it's around 36 are going to be released from isolation on the 25th. 39. I was close. 39. But they're going to be released from isolation, my understanding is the 25th, 26th.
Thank you, Ms. Lyle. Marie Sutherland, CBC.
Good afternoon. My question is for Premier Higgs. Does the fact that a New Brunswick worker at a Maine paper mill has COVID-19 is giving you any increased concerns about people who are crossing the border for work and whether the rules are strict enough? Is there any revisiting of that?
So with respect to any cases related to outbreaks in other jurisdictions, our information is transferred from our public health teams with whatever jurisdiction they're interacting with or liaising with. So all I can do is speak to the idea that we will continue to see travel-related cases. We will continue to do the same kind of contact tracing for each and every situation. And if there are elevated risks that we need to communicate within communities, that will be done at a community basis, on a community level.
Ms. Sutherland, do you have a follow-up?
Yes, I think this is also for Dr. Russell. It's a question about rapid testing and whether this will be coming to New Brunswick soon. I'm just thinking if it takes, a couple of days, 4 or 5 days to get a test and then 3 to 4 days for results and there's no rapid testing like there is in other provinces, how can that give an accurate result?
Well, first of all, we don't have that kind of turnaround time. We actually, within the time frame of somebody calling 811 or filling in the online assessment form to the time they get the sample taken, and from that time they get the test done, and the turnaround time is probably within 24 to 48 hours. So we don't have long wait times for people who are getting tested. Most people, if they have 2 symptoms, are supposed to be self-isolating while they get tested so they aren't putting others at risk. Rapid testing, there's different types of rapid testing, and some of the different types that are out there have different profiles in terms of whether or not they pick up all the different types of, if they pick up COVID-19 very sensitively. So there are false positives, there are false negatives, depending on who you test. So if you're talking about travelers who are asymptomatic, the gold standard really is the PCR test that's done in the lab at Georges Dumont. And but there are other rapid tests that we use in certain situations like outbreak settings, like in long-term care facilities, again, when we have to cohort people immediately, isolate people immediately. So those are the rapid tests that are done with Gene Expert, which is also a PCR-based test, but it is more rapid. We just don't have as many of those in terms of the abundance of that resource and the materials. So we do use those quite judiciously. There isn't a current backlog in any of the testing that we're doing. So again, the gold standard is the regular test that's done by PCR, and the turnaround time is really not more than 48 hours unless there's a surge, and that has happened. And then the actual priority does go to the people that we would be most worried about. So the people that have had their tests ordered by by public health because of their relationship to an outbreak or being a close contact to a case, et cetera. So as of right now, the difference between the different types of rapid tests out there, we do have some available. There are limitations to some of them, and they have to be used in certain settings with respect to asymptomatic versus symptomatic. Right now, we do have plans to look at other types of testing in terms of rapid testing and what context they can be used in. But right now, we're quite happy with how things are going with the two main tests that we're using.
Thank you, Doctor. Thank you, Ms. Sutherland. Andrew Watt, Telegraph Journal.
Hi, Minister Shepherd. Just kind of want to follow up on Silas's question. Why is it that the next clinic is the one in Moncton is only going to be for healthcare workers? My understanding is the one in Miramichi also had, nursing home residents, etc. So I'm just trying to understand, is this a policy shift, and have you prioritized healthcare workers over everybody else now?
Thank you for the question. No, this isn't a policy shift. This is a numbers management issue. And so we think the most, right now, I'm not going to even speak for public health or the professionals, but if I were to consider what the options could be, we have 975 tests. And what's the most efficient way to get them out in a short timeline and under the circumstances that we have? So no, this isn't a policy shift. Everyone needs to be vaccinated at some point, and so we're coming into Christmas time, we're coming into holidays, and we're looking at the most efficient ways to get people vaccinated.
Thank you, Mr. Watt. Thank you, Mr. Shepherd. Mr. Watt, do you have a follow-up?
I sure do. Mr. Shepherd, I'd like to have you talk about the program that you apparently were aware of, but the doctor wasn't, about following up on the long-term effects of COVID-19 on patients and what that has revealed. And I'd also like to know if the province has a program to track any side effects from people who have received the vaccine.
So I know about this because I was actually speaking with a researcher from St. John. So I actually don't know the details, and I don't know at what step it's in and how many people they're following. I'll be happy to get that information for you. But the issue is that we're 9 months down the road with COVID. And we're not going to know long-term effects for a little while. And so obviously it's going to be something that's going to have to carry on as information comes in. I don't know that they have any results at this point. But again, I'd be very happy to reach out, and we'll get you more information on that.
Thank you, Mr. Watt. Thank you. Minister Wildenette Paul, Radio-Canada.
Sorry, Bruce, I just want to answer.
Mr. Watt, you still online?
Monsieur Watt, est-ce que vous êtes encore en ligne?
Okay, so around capturing the information around side effects of the vaccine, as with any vaccine prior to the pandemic, there is a process by which that data is captured, and it is actually published on either the Health Canada or the Public Health Agency of Canada website with respect to all vaccines. So because this is a pandemic and we have 7 vaccines that are hopefully going to be rolling out over the next 9 months, we do have a system in place to track that information and share that nationally, again, to keep track of all the different types of reactions and side effects. And in all the different 7 vaccines, they all have different profiles in terms of efficacy and also different side effect profiles, and so that all that information is going to be available.
Thank you, Dr. Wildenette Paul, Radio-Canada.
Merci beaucoup, Bruce.
Thank you very much, Bruce. My question is for Dr. Russell. I wanted to clarify, there is a vaccination clinic from December 23rd to 27th. Where will it be exactly, and will it be for people from all across the province?
Alors,
frontline staff will be the people who get the vaccine, people who are directly in contact with the patients at the ER, in intensive care, in testing sites, and also all those who were invited to this clinic, and it will take place at the George Dumont Hospital in Moncton. Thank you, Doctor. Ms. Paul, do you have a follow-up question? Yes, please. Thank you very much. I would like you to explain why Moncton. I know that you answered this in English, but could you please give us an explanation? Can you explain to us why the specific region was chosen, and maybe also will employees from other cities in the province be able to get vaccinated? So there are a few reasons why it's in Moncton. There is the freezer, and because the first one was in Miramichi, and because so with Horizon, and there were people coming from across the province for the first clinic. For the second clinic in Moncton, Vitalité will be in charge of this one. But people from Horizon are also involved because as we get more shipments of this vaccine, it will be sent to other places in the province, but right now it is sent to Moncton because this is where they have their freezer, and also because they wanted to operationalize this implementation with Vitalité. Thank you, Ms. Paul. Eloise Rodriguez, Radio-Canada. Hello, my question is for Dr. Russell. It's about the gatherings during the holidays, the 20 people gatherings. It's more than anywhere else in the Atlantic provinces. So how did you get to this recommendation? And are you concerned about seeing an exponential increase of the cases? So to answer your second question first, yes, I am very concerned to see outbreaks. But I would like everybody, just like the Premier said, we would like everybody to be very, very vigilant. We say that people can gather with their close relatives with 20 people. It's the same 20 people, not 20 people one evening and another 20 people another evening. It must be the same 20 people throughout the holidays. And I know that some gatherings are going to be with more people than that, but it is very important to remain safe. And if people do not feel good, they should not participate in the gatherings. If you traveled, you must be self-isolating. That is very important. We want people to gather with their very close relatives, and 20 is the maximum. You should not have 20 people, and that includes the people who live in your house too. Thank you, Eloise. Do you have a follow-up? Yes. For the next vaccination campaign, so I understood that it was in Moncton. So how many people are going to be vaccinated then? And in January, how many do you plan on having? So the total is 1950, but that will be divided into two, so 975 people. And the next vaccine will be given 3 weeks from then to the same 975. Adil Ibrahim, CBC.
Questions for Dr. Russell. Late last week, we learned that Canada's allocation of the Pfizer vaccine doses may be able to actually inoculate 20% more people than expected. Does this mean that more people will be vaccinated in New Brunswick in this first vaccine clinic and in the coming clinics as well?
All I know is that the distribution of the vaccine is on a per capita basis, and the way that the vaccines are set to roll out, we will only have small numbers of doses in the first 3 months of the rolling out of how we're vaccinating people, and really we're only going to be able to vaccinate in total about 60,000 people in those first priority groups as the 2 first vaccines are rolled out. So very, very small doses, numbers of doses, and if there are changes in how we receive the vaccines in terms of the numbers of the shipments, et cetera, we will accelerate our priority group of vaccinations.
Thank you, Dr. Ms. Ibrahim. Do you have a follow-up?
Yes, also for Dr. Russell, is the province doing anything specific or in particular to prepare for a possible surge in cases after the holiday season? So if we lose control, as the Premier said?
We're praying. No, I'm joking. We are very concerned, and we're hopeful that, again, if we do everything right now, then that won't happen. But obviously, we have dealt with outbreaks across this province, Zone 5, Zone 4, Zone 3, Zone 2, Zone 1. So we are prepared in the sense that, we have everything in place that has been in place for all of the other outbreaks. We will still employ the same processes at the provincial level that we have with all of our partners that have been working so closely together since the beginning of the pandemic. And with each outbreak, we learn more and more. So all the learnings from the last 9 months are really collated quite well in our approach. So again, all we can do is, I am serious, hope and pray that over the course of the holiday season, that everybody does what they need to do to stay safe and keep New Brunswickers safe and keep your community from having to go into an orange phase of recovery, of response after the holiday season. So, and again, there was a letter that was sent out by Minister Carty for all of education and early childhood development around encouraging people to wear masks for those first 2 weeks when they come back after school. Anything that we can do to reduce the risk, that's what we want to do. That's why we are saying non-essential travel is not recommended and very much discouraged, because the risks are so high of bringing COVID with you when you travel to this province or when you leave the province and come back. And the risks of gatherings, increasing the risk, also a problem. And when we're not in a pandemic, these are normal things. These are normal behaviors. These are very, very healthy normal behaviors when there's not a pandemic. But during a pandemic, it is very, very risky and increases our chances of being overwhelmed in the new year, and we don't want to see that happening. So the only way to minimize all of those risks is, one, to decrease your number of close contacts and not have anybody doing any non-essential travel, and self-isolating properly if you are.
Thank you, Doctor. That concludes today's update. Thank you. Voilà la fin de notre mise à jour. Merci.